Where are the source of most infections in most people? Not 100%, but most people it's in the mouth. You're virtually, sounds crazy maybe, you're never going to see a sick person that has a healthy mouth. It's that profound a connection. And by the same token, if they are significantly ill, not just with cancer, but heart disease, all the other chronic degenerative diseases, and they're in their 50s and their 60s, I guarantee you've got problems going on in the mouth in terms of infected or inflamed gums, which are associated with, I hate the term association when it's clear cause and effect, but that's how they refer to it in the literature. But you have the cause and effect between gum disease and virtually every disease known to man in the literature to support that. And what do those gums do? The infection of the gums works its way down the periodontal ligament into the tip of the tooth, and you develop asymptomatic abscesses, chronic apical periodontitis. All this is covered in my book, Hidden Epidemic. And that's significant because, like an abscess anywhere in your body, it's highly toxic to your general health. And it's in a system, your mouth, where what happens? You chew. And when you chew, you generate some of the highest pressures known in biology. And in so doing, you actually express the pathogens and the toxins into your blood and into your lymphatic system even more efficiently than if you took a syringe and injected it intravenously. So it's really a double whammy. Having the infection, it's there. Triple whammy, not knowing it's there because it's asymptomatic. And then finally having a delivery system constantly pushing it throughout your body. Then you have root canals, which are 100% infected. And finally you have tonsils, which most people don't realize, even if they get all the infections cleaned out of their mouth, which they should, for long-term health, the tonsils are always going to be infected too, even if they appear normal in size and normal in morphology. They are chronically infected, but they'll never look like the kid that has acute tonsillitis. It's an entirely different process. So all of those things, and I know your situation with beating cancer, there's nothing more critical for a cancer patient to overcome his or her condition than obviously minimizing toxicity, but almost always identifying and removing the oral sources of toxicity. Same thing for heart disease patients, where they have the oral pathogens inside the coronary artery vessel, and breast cancer, where they get that infected lymph that swishes down, actually goes back and forth with the channels of the lymphatics into the breast tissues, and you can see that on thermography.
Thanks for watching. If you like what you just saw, why not subscribe? Here's a link to do that. And if you'd like to watch the full interview, you can find it at chrisbeatcancer.com. There's a link to it in the description right below this video.